Hello and welcome to Aging Matters. This is a program that's provided by and sponsored by the Berks County Area Agency on Aging. My name is Ann Barlet and I'm the Public Advocacy and Outreach Manager for the agency. Our show tonight is on helping with the cost of growing old through the VA, the Veterans Affairs Office. And with me, I have Derr, who is the director of the Berks County's Etchberger Veterans Center. That's almost as long as the Berks County Area Agency on Aging. So thank you, Dale. I appreciate you being with us. I know that we have a interesting topic, and I think people wanting to know how can I age with some help in terms of the costs of some things that occur as we age and the things that occur to us as we age as well. And our agencies work very closely together, the aging and the VA office, because a lot of cross services and individuals that qualify for programs perhaps under both of our areas. I wanted to just start with, I guess, something that's more common. You know, people are looking, I know that when we participate in resource fairs and things like that, some of the folks come to us and are inquiring about how do I pay for things that I need, and whether it be in-home services where I need some help at home, you know, getting my daily routine going, getting up and dressed and so on. And how do I get maybe some assistance with helping to pay for that, because it's not cheap. As we all know, you know, nothing is, and it keeps going, getting, you know, higher and higher. Or in some cases, folks that need some of that personal assistance have moved to personal care facilities, assisted livings, and are getting some assistance, and that also is several $1,000s a month to do so. And I know that one of the ways, as we lead in, is through the Veterans Affairs Office and the benefits, some of the benefits that you have. And before we actually start about that, I think one of the things that we both try to do, I believe, in all kinds of questions that we have, is sometimes in order to get help with paying for some things, we also have assistance and resources to take advantage of other programs or other benefits to that doesn't cost us as much and pays for something to give us more money to pay for this. You know, it's kind of a trade-off where we can get some, reduce this, qualify for this program, so we have money in our pocket to pay for this. So we're going to look at, and so I wanted to start with something that comes into play as we grow old and need a little bit of help, in-home services, or some help when we have moved to another living option like personal care or assisted living, is kind of the VA pensions and of course the dependency indemnity compensation. So that's a mouthful, and we will talk about both the VA pension and that. So let's start right in with describing for us a VA pension, and again what it is, what it's intended to do for veterans or anybody else who might qualify for such a thing.
Well, thanks, Ann. It's always a pleasure to work with you and the agency, and we have so many folks in our target population among military veterans and their spouses of deceased veterans that do come into need financially, especially as they age, and what can the federal benefits for military veterans or their survivors provide in terms of monthly assistance, in a way, of pension dollars, so that they can help with the cost of living. And sometimes folks outlive their means, and this is where their military service can be leveraged in the form of a pension. You and I set up side by side at aging parent fairs seemingly every month, And a lot of folks who care for aging parents come in, and they want to know these kinds of things too. A big benefit is the pension. The Congress established the veterans pension and the survivors pension to provide that monthly assistance to the level of what the person cannot provide to pay all of their bills. There is a pension, and then there are additional special monthly pensions that may be possible, but it is intended to provide money for the wartime era veteran, not necessarily a combat veteran, but a wartime era veteran. Peacetime era veterans don't qualify for this benefit. Congress was very specific about that, but wartime, and you can always check with us, and we know the war eras and can guide you. But it is money that is intended to provide that difference between what you can cover in your monthly expenses and what you can't, and that's what Congress intended for this particular type of benefit. It is a financial need-based benefit. It is not a guaranteed benefit, an entitlement. You must demonstrate that you have the financial need in order to qualify for those monies.
Okay.
Yeah.
So, and clearly there are guidelines to do so in terms of, you said the wartime, but there's some other things. So, and the financial need, and I'm sure there's age eligibility, what that relates to those wartime dates and things like that.
Generally, who qualifies for this is someone prior to 1980, someone who would have had to serve 90 days of active duty, not for training, but for operations, and at least one of those days during a period of war. After 1980, then that must be 2 years of their active duty service commitment or for their call-up period. And in order to qualify as wartime, in order to get to this particular benefit. And the person must be in that financial need in order to qualify.
Okay. So I guess my question is, they have to then be able to be willing to offer financial information, which I know is not always
that can be pretty touchy in a
acceptable
household,
to folks. That's a very private, I think, sometimes
right.
matter, and as much as it's still necessary to determine, and you have to share that information.
The veteran may have a spouse in the household who's also getting Social Security, also maybe earning still. Maybe there's that child who came back to the nest and is working but living at home. That has to, all those incomes have to be reported, and their assets have to be reported based on the household, not just the veteran, the veteran. And that's
but it is an individual pension.
That's right.
Okay.
And then but it is based on what the household cannot support for this veteran.
All righty. And so, same thing, so the dependency indemnity compensation.
That's a little different.
Yes. Can you tell me a little bit about that? And
we wanted to talk tonight briefly about this other benefit, which is DIC. DIC stands for Dependency Indemnity Compensation. And if I should die, I'm a veteran, and if I should die of a service-connected illness or injury, and then my family, my surviving spouse generally, but there may be dependent children, might qualify then for set established monies that may be available to them then. And right now that's about $1,250 of money that's available to the spouse based on me passing away, the veteran passing away from a service-connected illness, injury, disability, or being established out of disability for a certain level for so many years that pretty much guarantees that benefit. This pension we're talking about is not a guaranteed benefit. But DIC, if I got sick, if I got injured, if I died in the line of duty, that surviving spouse is guaranteed for the rest of his or her life this money.
And therefore, that's kind of any age. So somebody could have been diagnosed with this wartime kind of disease that they got whenever, and now it's manifesting themselves a little older or even younger at any age. That's
right. And generally on the pension side, then I'm 65 and older. I served in wartime, and then I may meet net worth thresholds and qualify for this particular benefit. This is called a veteran's pension. And if the veteran has passed away, then this benefit may be made available then to the survivor of that veteran. And that way, and I get this from a lot of women who are now widows. They're afraid of being kicked to the curb.
Yes.
That's how they often
Okay.
will say it to me.
Okay.
And this benefit can help with monies that keep them in their home or for their nursing home care.
And obviously it's something that you didn't probably think about or know about that it even existed, and that happens a lot of times with different programs and services, is that you don't know what's out there until you need it, and then sometimes you don't realize that you qualify.
That's right. And utilizing a medium like television and getting that word out, like the Area Agency on Aging does and how Veterans Affairs does, we want to continue to make sure that we help spread that news about these benefits, because quite often that death of the veteran causes a financial crisis in the household.
Yeah.
And if we know about these things ahead of time, maybe we can be better prepared and move into this type of claim for benefit immediately. We do depend on, for the survivor benefits, we do depend on the funeral homes. And the funeral homes are tremendous stakeholders in the success of helping me get people introduced to these benefits, and we really appreciate the work that they provide us.
And that makes great sense, and it's great that, again, there's another partnership to help that surviving spouse, because clearly they have identified that that individual is a veteran, the spouse was a veteran. Now, you mentioned something, I made a note, net worth threshold that they have to kind of get or be aware of before applying. Tell me a little bit more about that.
Yeah, and I want folks to remember, DIC, there's no financial picture needed, but now on this pension, if that didn't qualify, then we look at the pension. The net worth threshold that the VA will look at, the federal government VA will look at, is $80,000. You won't see that written in most documents out there, but that's pretty much how it works out when they work these claims, is that your net worth must be at or below $80,000. Then we can start.
Now, here's all the rest of the questions after you just said that. So what does that mean? What does that include?
Yeah, so all of my financial assets, everything that I may have in terms of checking, savings, the investments still that I have, it does not include the value of the home that I own. For the veteran or the survivor. That is not used until there's a sale of that property, and then that sale price has to be reported to the VA. It can be the value of a hunting camp. It can be the shore home.
That's what I was going to ask.
So things that aren't your residence will have to be valued, assessed and valued, and then that price would then be included in your assets. And remember, we're looking at the household in this case, and that can really add up in terms of all those financial pieces that you have set aside. Congress expects you to use them first.
Well, and many times the programs also that we have with similar types of guidelines in terms of assets, if something can be liquidated, so your own current home, no, because you need to live in your home, but the other home or the other, as you said, cabin and whatnot are assets that can be sold to get those funds to help pay for, as much as we may want to keep it. I want to go to Florida.
Congress is not going to kick you out of your home.
Right.
If you own it and you can continue to make payments if necessary, things like that, they're going to keep you there.
Okay.
But when you sell the home, you must report that to the VA if you're in this benefit.
Okay. So the next tricky question is, how can I rearrange some of those assets, some of the things I've got out there, to see if I can play with that to get me at that 80,000 or below? I know that's
I get this question from a lot of hardworking Berks Countyans who have set aside and for their retirement and things, and people have said, oh, so I get screwed again by the federal government. No. The law reads that we must use those assets first, and then when they do get down to the $80,000 level as far as your assets, then you can look to this benefit to help moderate your ability to pay your expenses each month. And that's where the veterans pension or the survivor's pension comes in.
So we were talking earlier, I know that even today, in an affair that we were both at, and people are talking about situations, and you mentioned that scams are now also kind of attacking, should I say, those benefits and whatnot. Tell me a little bit about what you're hearing. What's happening, or what are they questioning? What is that scam that you're hearing, and then what do we do?
Yeah, it's an awful thing. We held a scam seminar with the district attorney and the county detectives a few years ago, and I learned just from those groups that the military, the veterans, and our family members are the third most targeted group for scams. The big area is right here in pensions, is where the predatory practices, people come at us, and before thinking you believe that you're talking to the Secretary of the VA himself, and you've got to be careful with this. If anybody is recommending that you move your assets around and into irrevocable products and things, if you don't check that person out, you may be making a huge mistake. And we have had a lot of folks in our office crying their hearts out because they've committed their monies to irrevocable products. And for example, their heirs can't get to those products until they turn turn 75, 80 years old. And so they're tying up this money, and that company is making money off the veterans' money or the survivors' money in order to qualify for this. And that's a pretty awful thing, where in the fine print you didn't see that, and you're gone now, you've died, and your heirs can't get to those products and get to those monies that you have wanted to pass on to them. And if you get charged something, we have a number of people that I don't know how they're finding out the names of veterans, and worse, the names of survivors, but they have cold calls over the telephone, and they're offering to help get into this benefit, and then the veteran or the survivor learns that they're going to be charged maybe $3,000, $5,000 for this claim, when, like you and I as county government employees, we'll do this paperwork for you at no charge.
Come and see us.
It's part of you paying your taxes, and we get support from Berks County taxpayers, and we will do this for you and help you get into the money that is appropriate and by law and then entitled to you. It's tough.
I'm even thinking, you mentioned phone. I know that a lot of times people even get letters in the mail, and they make it very official looking, whether it be veterans perhaps seal or something, to be leery of. So, if they get something, whether it's in the mail or via a phone call, I think the best thing is, first of all, just stop and think. And then we will show your way to reach the office so that they can at least make a phone call.
And honestly, if they call the Area Agency on Aging, if they call the Berks County Department of Veterans Affairs, just to get that second opinion, that would be a good move on your part to do that and protect yourself against what may turn out to be a scam. If not necessarily a scam, it just may be a predatory practice that's just on the safe side of the law, but really is it morally and ethically the right thing for them to be doing to you and your money.
So speaking of money, so if we're sticking to, we've talked about the 80,000 with the amount or below as our net worth kind of thing. So what do we've got that as our financial piece we've given you. What else? What's next? What else do we do?
So the next step is to look at annual income and compare it to a maximum annual pension rate. And for a veteran, the maximum annual pension rate is $12,868 a year. And for the survivor of a deceased veteran, that is only $8,630 a year. So when you look at all your incomes of the household, is it below that amount? and the VA is then going to look at that difference and make up that difference, divide it into 12, and then you get monthly benefit paid out to you. But you have to be below that maximum annual pension rate. And that's usually folks don't qualify because they're above that rate.
Yes, I see, okay. So I guess I would ask, is there, so there's not changing any of that? How do I?
Yeah, and so what you can do is
What can I
offset
do?
income.
Yeah, okay.
Legally, you can offset income only by presenting what you've paid over the last 12 months in recurring monthly medical expenses. And so these are things that you know you're paying them.
Yep.
What you're paying for Medicare Part B and D,
Okay.
Private health insurance, the mileage to the doctor and back.
Really?
Yeah,
Okay.
especially for our seniors. They just don't, they know they're doing this several times a month often,
Yes.
and just keep
Yes.
track of that mileage
Okay.
to all of your doctors. And then all those over-the-counter items that we could ever possibly think of that we're paying for every month. And they may be the poison, that depends.
That's what I was
They
gonna
may
ask,
be-
if it can be
they may be
that.
antacids.
Okay, so it can be medications over the counter, it can be
I
products?
always say the front of the drugstore items that you need to buy every month, that's the kind of thing, and we have a list of, it's not an all-inclusive list, but
Gives
it's
us an
a
idea.
suggested list to look at as to what you might consider other items of expense, and they'd be recurring medical. And sometimes folks buy things in just 90-day supplies. We can figure all that out. And then dollar for dollar, we
Okay.
want to try and offset the income down. So for the veterans, we could get under this $12,868 if we can get the surviving spouse under the 8630. That's our goal, is to
Okay.
get you under. Now, I've got vets who are getting $80 a month, and then we have other vets who are getting the full $12,868 because they have so much in expense. Offset that in income.
And just to show that I get that on a regular basis, whether it's the depends or whether it's because I'm getting a medicine that isn't covered by something or I'm paying partial, whatever, do I keep receipts? And how long? You know, how can I prove that this is a monthly thing if I only keep 1 month's, receipt? Or
I don't know, I think I've become that government official who says, once you turn age 60, start keeping receipts on
Okay.
everything. Especially as you get into this kind of need, just keep an eye and say, oh, you know
Okay.
what, I'm going to start keeping all those receipts. I'm going to start recording all the mileage, and so that you can present that for need and justify your need. And I'm just that kind of official who says now, the more you can provide me with receipts, the better chance it is to be recognized as a recurring medical expense.
great, so we
Yeah.
can do that.
Yeah.
And then with Social Security, how is that affecting, I mean, as a social, I getting that as an income typically as a
Yeah.
retired individual?
The folks who are getting Social Security, quite often they're up around 12,000 a
Okay.
year and more, and so they're above that. And so they want to keep in mind how to use their medical expenses to offset all their incomes. Get under that maximum annual pension rate with the VA, and the VA is going to help you out with those dollars that are different. If you're under that rate, whatever that level is of your income final tally, that's what the VA is going to try and make up that difference, divide it out by 12, and that will be your monthly benefit.
So again, it's a way of also then being able to help offset the costs of medical expenses, the insurance, the coverage.
That's right.
Okay.
As that income starts to downslope, the expenses go upslope, and medical expenses especially. So this benefit is clearly designed for the person who is aging, now is age 65 and older, wartime, or it's the survivor of that wartime veteran, is try to get folks into this.
And one thing that I think people do not know, or even if they heard bits and pieces of it, and I've seen other things advertised for an individual who qualifies now. They've gone through the financial, they've worked it out that way, played with those things, brought in the expenses. Eventually, government follows that chain and it gets approved and they get that. How do you get it? it comes as an income to the
That's right.
individual versus.
And so
you know.
the monthly benefit, a tax-free benefit, will be paid out on the first of the month for the month we just came through.
Okay.
So that's how they do that. And then in the month of death, that money needs to be reserved and given back to the VA. I'm sorry to say that, that's law. You have to give that money back, but then we'll help you apply under a different means to get that money paid out. I hate to describe that, but that's
It's another show.
generally what has to happen.
Okay, because I get sometimes confused when people in facilities who you see, they say accepts the pension, and I always tell folks, well, they accept it because it's your income, it's not going to the facility.
Yeah.
They allow you to help to utilize that for that cost of that.
That's right.
Stay.
And you talk about facilities. If I'm housebound at home, then that maximum annual pension rate jumps up significantly. If I am in need of somebody to come into my home and I'm paying for that care out of pocket, then that is called aid and attendance. And both of those are special monthly pension add-ons that would produce a higher maximum annual pension rate. So it's a little easier to get under it. And as you and I know, in-home care is expensive, but residential care may be lots more expensive.
Yes.
And so we want to get folks into these special monthly pensions, where if you're receiving DIC benefit, it would be considered special monthly compensation, and get folks into these additional monies to help pay for that cost of care. A medical crisis where I'm now housebound, I'm now paying for somebody to care for me, can really cause the downslope on the assets and such to move along. That spending to move along very quickly, and this helps to moderate that time that your money lasts before you can get into Medicaid eligibility
and coverage that way.
Yeah.
We have only 2 minutes, Dale. Unfortunately, we could be here for another 30, but to wrap up, let's just tell how to learn more or talk more about these two, the pension benefit and the, let me see if I get this, the dependency indemnity compensation benefit by contacting your office.
Well, first off, you can go to the VA website at www.va.gov and look under pensions, and you'll see all the write-up about what we were talking about tonight. And we do have a Tuesday afternoon benefits presentation at the office at 8th and Cherry Street, 726 Cherry Street, Tuesday afternoons at 1:30, and come join us, and especially with spouses and maybe even the family caregivers that can come in with you. We'd love to have you join us.
And that at any time they can call your office to make an appointment, to actually have some time to sit down.
We have nice mailers to send out to you to get you started into thinking about what it takes for these benefits that we talked about tonight, and I'd love to have you get started on it. Don't let those, especially those widows and widowers, not know about this. Spread the news to them, because that's often a population that just does not get the word.
And let's share one more thing before we say goodbye. Is there's a special event that I know you'd like to share, and we'd like to promote that a little bit.
It's the Berks County Veterans Appreciation Dinner and Dance, November 12th, 4 to 10 p.m. Tickets are now available at the Boscov's customer service desks. And if you need more information, give us a call at our office. Our information is going to come up in a moment, and we'll help you out.
I'm sure that's going to be a great event. That's wonderful. Well, thank you. That's really all the time. Thank you, Dale, for your time and the wonderful information. And thank you for tuning in to Aging Matters.